is. Let's go ahead and invite Dr. Marisa. Okay, 1 second.
Hi, how are you?
Hello. Hi.
Good.
I'm
It's
doing
good
great.
to
How are
see
you?
you. I know.
You
I
too. It's been a
know.
little
I
bit.
feel like time is flying though.
It is. It is. I'm right there with you. All right. Now that everyone is on, let's get over our little legal disclaimer before we get started and jump into today's topic. All right, the information provided on this live is for educational purposes only, does not substitute for personal medical advice. We advise users to consult a local medical professional or healthcare provider if you're seeking medical advice, diagnoses, or treatment. All right, so now that that is done, welcome everyone who is joining us here on this live and for this segment of Derm Talk. If you haven't, joined one of these before and aren't really quite sure what they are, these are segments that we do on Instagram. We've done it once before on Facebook. They're really fun. We sit down with a dermatologist from our dermatology advisory board, and we kind of talk about all things skincare concerns, skincare issues, anything at all relating to skin. So if you ever have questions or anything that you would like us to ask one of our dermatologists when we're sitting down speaking with them, please either email us at hello@dermatology.com, or you can reach out on any of our social media channels, Instagram, Facebook, we're even on TikTok. Any of those, you can send us your questions and we will make sure to, or even a topic that you want to talk about. If it's not a question, but there's a certain topic that you would like to hear about or are interested in, then send them our way and let us know, and we will definitely do that. So for this segment of Derm Talk, we are here with Dr. Marisa Garshick. Before we jump into our topic today, could you maybe just introduce yourself, maybe your practice a little bit, what got you into dermatology?
Well, excited to be back here doing these. So I'm Dr. Marisa Garshick. I'm a board certified dermatologist practicing in both New York City and Northern New Jersey. And in my practice, I see medical issues, I see cosmetics, I do surgical procedures, and really just love talking all about skincare, which is why I'm excited to talk today, and really enjoy being able to educate and do what we do, which is really just try to give people the tools that they need to be able to protect their skin and look and feel their best.
Absolutely. Yep. That is why we do what we do. Okay, so today's topic that we're going to talk about is perfect for this time of year, obviously. We're going to talk about sun protection and why you need it, the importance of it, how to do it properly, and all of those things. Now that the weather is finally changing and it's starting to get warmer, the sun is coming out, people want to get outside, but we need to think about protecting ourselves from the sun. So we're gonna, we have a list of questions here that we already have from some of you who have sent stuff in. We're gonna start going through these, but if you think of something while you're watching this and you have a question about sun protection, please drop it in the comments and we will get to as many as we can. So to get started, talking about sun protection, let's just start with the basics.
So we know that with the sun, it emits different types of UV rays and different types of high energy, visible energy. And so all of these things can actually have an impact on the skin. And so this can be important because it causes signs of skin damage. So whether it's fine lines, wrinkles, sunspots, and most importantly is that the sun can be a cause of skin cancer. So really we want to make sure we're protecting our skin both to help protect the appearance of the skin, but also the health of the skin.
Mm-hmm. Right. So when it comes to the seasons changing, getting warmer, is there a way that you should be changing your normal regular skincare routine to something different? Like, should your summer routine look different than, let's say, your winter routine?
The basics should still be there, whether it's winter, spring, summer, or fall, but the type of product you use might vary a little bit in sort of the formulation or the heaviness or whatever it may be in terms of the specific ingredients that your skin is really depending on during that season. For example, in the winter, oftentimes we're drier, so we tend to rely on thicker or heavier creams. I know somebody was mentioning the peptide night cream. I love that. I mean, I love it all year, but it's especially great in the winter months. While in the summer, you may stick with something that's a little bit of a lighter weight formulation. So opting for a lightweight moisturizer as opposed to a thicker cream in the winter months. Your cleanser, similar thing. You may find that in the winter months, you need a more rich, creamy, hydrating cleanser, while in the summer months, especially for those who are more oily, we might opt for more of a gel or a foaming cleanser, or looking for certain ingredients like a salicylic acid in the cleanser to help remove that excess oil. But the basics of a routine should still be there, whether it's the winter or the summer or the fall. And what's most important is that obviously we're going outside more as the weather warms up. And so really being mindful of making sure that sun protection is always in your skincare routine. So in the winter, we also recommend it. But in the summer, it's got an extra check plus plus where it's really necessary, because we know that the UV rays tend to be stronger in the summer months.
Right. That kind of actually, someone else had written a question. It was lower on my list, but we're kind of on the topic, so I'll bring it up now. Okay, so obviously SPF year round, you know, winter, summer, spring, fall, doesn't matter. But that kind of falls into a category also where a lot of people think, if I'm inside all the time, do I really need SPF? Like, what do you recommend SPF if you're going to be inside all day, or if you work in an office and you're barely outside, or anything like that? Do you still recommend
partially
wearing
because
sunscreen?
I'm very routine oriented, and I think many of us are, and sometimes you don't know what your day is going to bring, and so sometimes put it on in the morning and that you're protected throughout the day, so that if you do end up running outside to check the mail or to take your dog for a walk, you know you have that assurance that you're covered. And on the flip side, when you're inside, you still, I mean, I'm sitting right here next to a window, and there are UVA rays that can actually penetrate through windows. So you are, even if you are inside, especially if you have exposure to windows or doors, there is a chance that you could still be experiencing UV injury. And then thirdly, we often are talking about now a little bit more of the potential impact of blue light on our skin. And so blue light is emitted from the sun, but it can also be emitted from our devices, whether it's our phones or our computer screens. And while more research is needed to determine the full sort of effects and impact of it, some data suggest that in people who have darker skin types or maybe more prone to hyperpigmentation, it may actually worsen pigmentation. So even wearing sunscreen when you're inside, especially if you're somebody who's dealing with melasma or any kind of hyperpigmentation, can be especially important.
Right. Absolutely. Yeah. I feel like even as I get older, you start to see these spots pop up, and yeah, you just want to make sure you're always covered and protected. Okay. So even if you're going to be inside, we talked about how you should wear it, but what if, let's say there is a day and it's not sunny outside and it's super cloudy? Do you still need your SPF then?
Yes, so another great time to make sure you're still wearing it, because those are actually some of the trickiest days. And I'll have patients who come in with a sunburn who actually say, but it was cloudy, I didn't realize. And the UV index can still be present even when there's not sun. So if you see it's cloudy, it's rainy, it's snowy, all of those times are still times when you may still have some UV present. A nice little trick is actually for people who have smartphones or iPhones, in the weather app, actually at the bottom, it actually will indicate what the UV index is. So you can sort of see if it's 1, 2, and above, you know, technically your skin should be protected.
Okay. For those that do have the dark spots like that, the hyperpigmentation, is there a way, what's the best way to treat sunspots and hyperpigmentation?
Yeah, so it's definitely a loaded question, because we have so many great ingredients that can help to address hyperpigmentation. So when it comes to skincare, I always say with hyperpigmentation, your number 1, 2, and 3 treatments are always going to be sunscreen. So hyperpigmentation, it's so important to wear sunscreen, not only to help improve what you have as existing, but really also to prevent them from getting worse. Their ingredients can also include retinoids, can be very helpful, exfoliating acids, so whether it's lactic acid or glycolic acid, and then there are some specific ingredients like kojic acid or tranexamic acid or licorice root extract. So a lot of these do have lightening functions as well. And then we have in-office procedures that can complement the skincare routine, whether it's through lasers or resurfacing or chemical peels, that can all work very well for hyperpigmentation.
Okay. Where did I go? I just had it right here. Okay. Talking about sunburn, I know we mentioned that earlier, but if you do get a sunburn, let's say you put it on in the morning, you didn't reapply during the day, you got burnt, or maybe it was one of those days you didn't know that you were going to be running outside and you did, and you were out for a while. What's the best way to treat a sunburn once you do have one?
Yeah, so I mean, so it happens, and we're all human. Generally speaking, one of the key things is it may go without saying, but you want to avoid intense sun exposure immediately after. Using cool compresses can be very helpful. So using any kind of aloe vera or cooling or soothing topical cream can be very helpful for the skin. Taking an ibuprofen can actually be helpful because if you take it within that first 24 or 48 hours, it can help to reduce some of the inflammation that's contributing to the redness and the swelling that goes along with sunburns and the discomfort of the sunburn. And then a lot of it's just making sure that you are gentle with your skin. So minimizing harsh ingredients, abrasive scrubs. If you are peeling, it may be tempted to actually peel your skin manually, but do not do that. Just make sure you're using moisturizers to help to support that skin barrier and recovery process.
Okay. Now, for those people, let's say that, you know, are out in the sun, they love the sun, they can't wait to, you know, call them a sun worshiper or whatever you want. They just want to tan. Like I said, the weather's finally changing. They want to get outside, get some sun. Is there such a thing as like tanning the right way or responsible tanning? Is that even a thing?
Yeah, so I mean, it's not, because at the end of the day, any tan is a sign of some DNA damage on your skin. So having a tan is indicative that the sun reached your skin and caused problems. Now, I often will say that the healthiest tan is the one that comes from a bottle. So for somebody who likes the appearance of a tan, sometimes the self-tanning lotions can be helpful. Now, obviously, if you're somebody who's wearing sunscreen, reapplying regularly, and you still happen to get a little bit of a tan, we know you're doing the best you can. But in terms of sort of the idea of getting a tan to prevent a sunburn, or saying I'm going to go on vacation, so I'm going to get a tan in anticipation, that is a very much a no-go. So definitely avoid doing that as we approach the summer months.
So kind of bringing up the you know, best tan that you can have is the one from the bottle. Are safe tanners safe? Like, are they? Or suntan?
Yeah, you know, they are. I mean, as with anything, there's always going to be questions about different ingredients and the safety, but at this point they are safe. The ingredients are considered FDA approved for the use. But with anything, always make sure you're speaking to your doctor. If you're somebody who has sensitive skin, you want to make sure that you're taking all of that into account.
Right. And we talked about, you know, kind of those people that do, like, let's say they're going to go on vacation or they want that base coat tan. Some people opt for, you know, I've heard this so many times, and I had a friend just post about it last week, and I wanted to be like, no. It's like, yeah, I only go to the tanning booths like for 2 weeks. So just the beginning of the season to like get my base tan. So let's talk about the tanning booths then. Are they just as bad as the sun? Are they worse than the sun? Should you ever do it, even if it's just for 2 weeks at the beginning of the season, or never?
Yeah, no. So tanning beds, I would say, are definitely important to avoid, because not only, I mean, I will say we didn't always know the harm that they could cause. And so if you did in the past, what's done is done. But in terms of going forward at this point, you really want to avoid it. Tanning beds tend to incorporate what's known as UVA rays. And so UVA, while those are also emitted from the sun, they're actually much more potent potentially than UVB, in the sense that they can penetrate deeper. They have been linked to increased risk of certain types of skin cancer, including melanoma, and can be associated with signs of skin aging. So fine lines, wrinkles, photo damage. So if the fact that you could get skin cancer isn't worrisome to you, then the fact that your skin might age might be. And so we know more about just the implications of UVA. And so, I mean, there are statistics that even just one time being in a tanning bed can increase your risk of skin cancer. So it is important to just make sure that avoid the temptation and do your best to try to embrace the skin that you're in.
Right. Absolutely. That's so important. So important. So when we talk about, you know, being safe and wearing your sunscreen out in the sun, there's so many different ones out there. There's, you know, you hear about mineral sunscreens or chemical sunscreens, or there's hybrids and a mix of both. Is there one that's better than the other that you should, you know, kind of always reach for? Or can you kind of explain those a little bit, what the differences are maybe?
Yeah, absolutely. So, I mean, this is where I know I've been saying no to a lot of things. This is where I'm going to say yes. So at the end of the day, the best sunscreen is the one that you'll use. And so whether it's mineral, whether it's chemical, whether it's a hybrid, ultimately it's finding the one that you know you'll like and you'll wear every day. And so for those who maybe prefer a mineral sunscreen, I find that those that contain zinc or titanium, basically zinc oxide or titanium dioxide, are especially good for those who have sensitive skin. So sometimes the chemical filters can be more irritating or more likely to cause an allergy. So it's important for those with sensitive skin maybe to opt for mineral. Those who maybe prefer to avoid having any kind of white cast may opt for more of the chemical filters, although I'll caveat it by saying there are a lot of great sunscreens, including dermatologies, which contain the mineral blockers without leaving a white cast. And so I love Daydream, and today I'm wearing my universal tinted physical. So so it's really nice if you are somebody who's concerned about a white cast, opting even for a tinted sunscreen that kind of does a nice job of camouflaging into your skin and providing the coverage. So really there's no wrong sunscreen to use. It's really just a matter of finding the one that's best for your skin type. The caveat being, if you're sensitive, you might want to opt for a mineral sunscreen or a physical sunscreen.
Okay, yeah, I do have a friend actually over the weekend. We had my bachelorette party. We were out by the pool one day, and she was saying how she doesn't usually wear sunscreen on her face, especially, which is the, it's so important to do that. That's the one part that's always going to be in the sun. But because of that, because of the white cast, and she does not like the white cast. And I had my Daydream and I gave it to her, and she actually fell in love with it. It's a fantastic mineral sunscreen that really, really doesn't leave the cast at all. It blends right in seamlessly. So it's definitely a good one. It's the best mineral one.
Yeah, no, it's great. And honestly, I will say that it's one of those things that sometimes you have to try a lot of sunscreens in order to find the one that you like. And so if you're sitting out there and you don't have the sunscreen, I know a lot of people are writing in what's the best sunscreen. Test them out, find the one that works for you. And then once you find it, you don't always necessarily have to change. This is a relationship that can be long lasting. You can stick with it. And if you find something you like, just keep going with it.
Yeah, you're right. We did see a lot of people asking here. I've seen them on the questions coming, like, what's the best sunscreen? But I did see a couple people specifically ask, what's the best sunscreen for someone who's pregnant? If you're pregnant, should you opt for something different, or are all of them safe to use?
Yeah, so I mean, in general, in terms of the evidence behind any sort of concerns with chemical sunscreens, it's limited. So many people will say for people in pregnancy to stick with mineral sunscreen, just because we do have the FDA approval as the mineral ingredients being generally recognized as safe and effective. So zinc oxide and titanium dioxide for those ingredients. So there is some support of the safety and efficacy of those mineral blockers. I personally use both during my pregnancies, but oftentimes we'll say to stick with mineral, partially because some people in pregnancy are more susceptible to hyperpigmentation and melasma, and sometimes the mineral blockers may be more effective in that setting. And also sometimes during pregnancy, your skin may become more sensitive. And because mineral blockers tend to be less irritating on the skin, that's another reason why it can be helpful in the setting of pregnancy.
Okay, now what about the difference between, let's say, a cream SPF and like a spray, like the kind that you can get in the simple, easy, convenient aerosol bottles? What's the difference between those? Can you use them the same way? Is there one that you could kind of lean towards a little bit more?
Yeah, absolutely. So some sunscreen is better than no sunscreen. So I'll start it by saying that. So if one is your preference, then just stick with it. But the idea is that when we have a cream, we know if we're applying enough of it that we're going to get an even layer across the body surface area. Whereas with a spray, oftentimes what ends up happening is it's splotchy. So you spray, it's very intense in one area, but you may not get full coverage everywhere. So the key with a spray, I always say, is if you're glistening, then you're listening. So you really want to apply enough spray, not like spray it in front of you and walk through it like a mist. You want to make sure you're getting like a full application, making sure that the skin is receptive, and then in many cases making sure that you have an even layer. So wherever you are applying it, making sure that you see that the area is completely covered. But in terms of preference, I mean, I think the ease of a spray, especially if you're on the go for reapplication, I myself also use a spray, so I do feel good about it. But you do just want to make sure that you're using it correctly.
Okay. And then how often should you be applying your sunscreen? Is just once in the morning before you leave for the day, is that good enough? Do you need to be applying more? throughout
Yeah,
the day?
so typically we say in order for sunscreens to maintain their efficacy, so what's indicated on the label of the bottle is basically to reapply every 2 hours, sooner if you're going to be swimming or sweating. So if you are exposed to water in some way, then you would want to reapply. Now, of course, we say every 2 hours. That's generally with exposure to the sun. So if you apply it in the morning and then you're not outside throughout the day, or you're sort of just asleep in your bed, it's not going to be as important to reapply. But certainly with exposure to UV, you want to make sure you're doing it every 2 hours. So especially with the summer, going to the beach, 2 hours is your set an alarm on your phone,
Right.
so that you know at when 2 hours pass, and you'll make sure to reapply.
Okay. And then for sunscreen, we always say you should always, every single day, like you were talking about, making it part of your routine. That's going to be your last step in your morning skincare routine. So, let's say you put a moisturizer on your face and then your sunscreen. Are there certain moisturizers that you should maybe use more than others that maybe, won't block the sunscreen or anything like that from your skin? Or because someone was asking here, which moisturizer before sunscreen would be best?
Yeah, so I mean, that I would say again, that is pretty personal preference dependent. There's no real sort of regulations on that. Sometimes we say that the chemical filters do need to have some time to absorb into the skin prior to going outside. So we sometimes say like 15-20 minutes.
Mm-hmm.
So just giving yourself that type of time. But in terms of specific type of moisturizer, I don't anticipate having an issue with any of them.
Okay. What about the amount of sunscreen that we should use? I know you said like even with the spray or the lotion, you want to make sure you're getting that full coverage, that full base. But is there a certain amount that we need to kind of make sure that we're getting the bare minimum? This is what you should do.
Yeah, absolutely. So for the body, you want to use the equivalent of a shot glass, so about 1 ounce for the whole body per application.
Okay.
And so that's an important number, because when you think of how much is in a shot glass, that's actually a lot more than most people apply per application.
Mm-hmm.
Now, for when you're just thinking about the face and the neck, that's when we often will talk about the 2-finger length rule. So basically applying it the lengths of your 2 fingers, and then applying that to the face and the neck. And that's often a sufficient quantity for per application.
Mm-hmm. All right. Yeah, it is a lot more than you think. Because I heard that. I was like, that doesn't seem like a lot for my body. And then we did a measurement and we looked at it. Whoa.
I know.
To put on. So yeah, it was a wake up call when I actually did that for the first time to see how much it was that was needed for your body.
Well, it also highlights that when people go on vacation and they come back with the same sunscreen bottle, you're like, wait a second, were you applying enough? Because that should have only gotten you through like 3 or 4 applications. Yeah. So that's a good barometer for yourself to say, am I applying enough? See how much sunscreen you have left at the end of a beach weekend.
Exactly. I can't tell you how many times I've had the same bottle in my little basket thing in the bathroom, and I had it for 2 months.
Yes.
Like, clearly it was not being utilized properly.
We've all been there, myself included.
I know we talked about some people with skin sensitivity and how it might be best for them to opt for maybe a mineral sunscreen. But someone was asking also on here, that sometimes their eyes get really irritated when they put on sunscreen. Is that the same kind of rule with that? Or are there certain sunscreens that are going to irritate the eyes more than others?
Yeah, so typically mineral sunscreens are going to be best in that setting. Also sunscreens without fragrance, so looking for a fragrance-free option. Mm-hmm. And this is where sometimes even like a stick sunscreen can be helpful. So for somebody who's active, potentially it just might not have as much of that cream potential. So finding something that's also, regardless of the formulation, whether it's water resistant, because if you're sweating, sometimes it's the act of sweating that causes the sunscreen to run a little bit. So finding a product that holds that a little bit better.
Mm-hmm. And then when it comes to like the SPF number, you see every number ranging from like 10 and 15 all the way up to some bottles say 100. What exactly is that number? And is there one that we like absolutely bare minimum always need to have no matter what? Or is there, what is it exactly?
Yeah, so it refers to what's known as the sun protection factor. And it basically gives you a number of how long it would take your skin to burn with and without protection. And so the idea is that products containing SPF 30 block about 97% of the UV rays. So usually that's our minimum. So we say SPF 30 or higher is generally what you want to stick with, because anything less than that is probably not providing enough protection from UVB rays. Now, the higher you go, certainly one would think, oh, okay, that seems like it's a better thing. Higher is better. But we found that some people do get a false sense of security. So if they use SPF 100, they may be like, oh, okay, so I'm good now. And that's actually not the case. So we often will say SPF 30 or higher is good if you're applying enough. Now, in real world applications, many of us don't apply enough sunscreen. And so for that reason, an SPF 30 is actually equivalent to maybe a half or even a quarter of that based on how most people apply it. Mm-hmm. So with that background and understanding, some people do say, okay, well, if you apply an SPF 50 using real world applications, maybe then you're actually getting SPF 30. So since there's a lot of complications with all of this, at the end of the day, just apply the right amount and make sure to reapply. And then if you do that, SPF 30 or anything higher than that is good.
Okay, and then we've seen this one come up a couple times too, and it is very, very important. For the parents that are watching and they have little ones, is there an age that they should be starting? Like, is there such a thing as being too young before you start putting on sunscreen, or what should you do for your kiddos?
Yeah, so the general recommendation is less than 6 months to avoid sunscreen. And that doesn't mean to avoid sun entirely, but generally we rely on methods of kind of wearing sun protective clothing, seeking the shade when possible, and sort of doing the measures that you can to just minimize sun exposure for a baby. After 6 months, it's really a matter of just applying the sunscreen. Typically, we usually recommend mineral sunscreens, again, mostly just because babies sometimes have more sensitive skin and kids have more sensitive skin. So because those are less irritating, they're more ideal for younger children. That being said, as kids get older, ultimately it's a matter of whatever you can get on them. And if it's easier to use one of these chemical or hybrid sunscreens, that generally is fine too. And recently somebody asked me, like, okay, I'm going on a trip and my baby's 5 months and 2 weeks. Is it okay if I put sunscreen on? So the idea behind 6 months is obviously there's some give there. But generally speaking, it's mostly just to emphasize that we want you to minimize direct sun exposure, avoid prolonged sun exposure, seek shade when possible. But if you needed to use a little bit of sunscreen, it should be fine.
Okay. All right. Let's talk lips. I know for me personally, if I'm in the sun, my lips are extremely, extremely sensitive to the sun. I always have to have an SPF lip balm or something with me. So even if you don't have that sensitivity on your lips, I don't think a lot of people think about their lips when they're putting on their sunscreen in the morning. I know I don't put my normal sunscreen over my lip. So is that important? Like, do your lips need the exact same protection as the rest of your, face and body? Yeah,
so your lips are very important. They're exposed to the sun the same way the rest of your face is, so they definitely should have the same attention. And they also can experience aging, and so lips can become dry as we get older. They can experience a type of sun damage known as actinic cheilitis, which essentially relates to sun damage of the lips, but also you can develop skin cancers on the lips. And so certainly based on that information alone, it is important to remember and to try to be as diligent as possible with. Certainly you can apply your regular sunscreen and just put a coat on your lips. If that's not ideal, there are different lip balms that actually also contain SPF, so that makes it easy.
And is the same rule apply for the lip balm too when it comes to like the SPF and the number? Because I know a lot of them are 15s, and I see a lot of them that are 45s or something. So
yeah, so I would say still 30 is going to still be better just because of the amount of UV blockage that it's providing. But again, this is also an area where I find if you're using one and you're using it regularly and it happens to be a 15 and it's the only one you've ever found that your lips do well with, I'm usually okay with that.
Like you said, the one you use is the one you should always grab.
Exactly.
Okay, so we have a couple more questions before we wrap things up. So if there's anyone watching and they have a question, be sure to drop it in here real quick, and we can hopefully get to it before we wrap things up. But this is a great question, actually, this next one that I have on here. I know in the summer, obviously you're outside, you're probably sweating a little bit more. You start to break out because your pores are clogged. Is there any recommendation that you have for preventing breakouts during the summer months?
Yeah, so I mean, in general, for preventing breakouts, that's going to be when you're looking for ingredients that help to reduce excess oil, things like salicylic acid, retinols, things that are going to help to regulate skin cell turnover to prevent the pores from getting clogged. But I often hear from people that my skin is oily. I don't want to wear sunscreen because sunscreen is going to make it worse.
Yeah.
But the reality is you want to look for a sunscreen that's what we consider to be oil-free or non-comedogenic, and that's going to basically achieve the benefit of sun protection, but shouldn't really have an impact on your breakouts. And so, especially for somebody who's dealing with breakouts, I always say sunscreen is important because you want to make sure you protect your skin from developing scarring. And after a breakout goes away, often it leaves a blemish behind, which when it's exposed to the sun, that can make it more obvious and more apparent.
Yep. And then you hear the term and a lot of people don't know what it is. You're just kind of familiar with it. Broad spectrum. You see it on, all types of different SPF bottles, but what is broad spectrum? What does that mean?
Yeah, so broad spectrum highlights the idea that you want your sunscreen to protect you against both UVA and UVB. SPF, so the idea behind SPF is really just referring to UVB protection. So the idea and why broad spectrum is recommended to be placed on a label and is looked for on a label is that tells you that you're going to get coverage not just against UVB, but also against UVA.
Okay, so it covers both of them. Broad umbrella.
Exactly.
Covers them all. Okay, one more on here. Are there certain products that don't pair well with SPFs? Like, you hear some things, you shouldn't mix these two skincare products together, or, they don't play well together. Does any of those apply to SPF?
Honestly, it's one of the first times I've ever been asked that, and I think it's a great question, but really, no. I mean, I think really you have a lot of flexibility, and in fact, most ingredients should be paired with SPF, meaning certainly if you're using any kind of active ingredients like retinoids or exfoliating acids, you always want to make sure you're consistently using a sunscreen, not just on the day you're using the product, but also the subsequent days as well. And then I also always like to highlight that in conjunction with sunscreen, vitamin C is a great pair. So pairing the two together, so having a morning routine where you're doing your cleanser and then a vitamin C serum and then a moisturizer and then a sunscreen is going to really set you up perfectly for the day, because that vitamin C is going to provide protection against free radical damage. So even though our sunscreens are great and we're talking all about the benefits of it, sometimes that UV does get through. And so your vitamin C provides these antioxidants that are there to essentially protect the skin from any damage that could be done from the UV. So you want to think of the two as sort of a super pair, because they're really going to help to support one another, do the best job possible.
Nice. Awesome. Thank you so much. I feel like we've learned a lot. We covered a lot today. But I hope that this was kind of perfect timing for everyone. Now that everyone's excited to get outside and be in the sun, hopefully now we know exactly how to take care of ourselves and protect ourselves. So we're going to go ahead and wrap this up today. But I want to thank everyone for who tuned in and watched. Thank you. We hope you learned something. And Dr. Marisa, it was great to see you.
So nice to see you.
We appreciate you coming on and teaching us and giving us all your knowledge. So thank you.
Thank you for having me.
Not a problem. All right. We'll see you next time, guys. Thank you for tuning in.